And in the space of a very short period of time, we had about 2 to 3 patients who were admitted to the hospital for gastric bleeding. One of them actually died, and one other one almost died, and we fortunately were able to save the third one. But the cause for this disaster was ibuprofen. They were taking ibuprofen chronically, non-steroidal anti-inflammatories. And so I said to myself, this is insanity. This is truly the definition of insanity. Doing the same thing over and over again, crossing your fingers and hoping that you get good results, and that problems don't happen. But they almost always happen, particularly if people are taking it chronically. And we now know that about 30,000 people per year die in the US from ibuprofen or non-steroidal anti-inflammatory. In fact, the recommendations used to be older people should be on aspirin to prevent strokes. Now it's certainly being discovered that there's more morbidity caused by the aspirin than there is a huge benefit for stroke prevention. In other words, more people have problems with it than people who have benefits from it in terms of the stroke.
Welcome to the PEMF Effect, where breakthrough science helps take control of your health. I'm Dr. William Pawluk, and I'm here to guide you in tapping into the power of PEMF therapy for recovery, vitality, and total body wellness. From overcoming chronic pain, optimizing brain health, boosting energy, and aging with strength, this podcast is your path to cutting-edge solutions for lifelong well-being. If you're ready to move beyond symptom management and tap into your body's natural healing ability, you're in the right place. Let's dive in. Today's episode is a previously recorded session from a summit where I was a guest speaker.
Welcome to this episode of the PCOS SOS Summit. I'm your host, Dr. Felice Gersh. And we, on this episode, are going to be covering a topic you may never have heard of. But once you learn about it, you'll be so glad you did, because it's a topic on pulsed electromagnetic field therapy. And I'm so excited because I have the world's authority on this topic with me, Dr. William Pawluk. Welcome. Thank you so much for joining me, Dr. Pawluk. And I hope you'll tell us how you got into this really unique field and how it applies to women with polycystic ovary syndrome.
Thank you very much for having me on. I appreciate having a chance to talk to you and your listeners, viewers, whoever, right? And the friends of friends, as we know will happen as well. Well, basically, I'm a family physician by background, a medical doctor, and I've been practicing for longer than I want to admit. And along the way, as happens to many clinicians, they hit walls, they hit problems or discover problems that they don't know how to deal with. Or they know how to deal with it in traditional ways, but the traditional ways can cause their own problems. So that's what happened to me. So along the way, I was practicing my typical medicine, and I was the medical director of a group of family physicians. We had the biggest family medicine medical group on the whole East Coast of the U.S. We had 14 family doctors. And so I was the medical director of that group, and we also shared patients. So we'd be rounding in the hospitals, and anybody who got admitted to the hospital, we'd share patients all the time. So I was basically in charge at that point, rounding on patients that were admitted. So it was my rotation, if you will, to do that. And in the space of a very short period of time, we had about 2 to 3 patients who were admitted to the hospital for gastric bleeding. One of them actually died, and one other one almost died. And we fortunately were able to save the third one. But the cause for this disaster was ibuprofen. They were taking ibuprofen chronically, non-steroidal anti-inflammatories. And so I said to myself, this is insanity. This is truly the definition of insanity. Doing the same thing over and over again, crossing your fingers and hoping that you get good results, and that problems don't happen. But they almost always happen, particularly if people are taking it chronically. And we now know that about 30,000 people per year die in the US from ibuprofen or non-steroidal anti-inflammatories. In fact, the recommendations used to be older people should be on aspirin to prevent strokes. Now it's certainly being discovered that there's more morbidity caused by the aspirin than there is a huge benefit for stroke prevention. In other words, more people have problems with it than people who have benefits from it in terms of the stroke. So, okay, this is the terrain that we're working on, and I said I have to do something different. I know that my consultants and my peers and colleagues all of medicine at that time, and this is back in the 80s, all of medicine at that time didn't have too many tools except non-steroidal anti-inflammatories, ibuprofen, opioids, surgery, procedures, etc. So, in fact, in the 80s, we were more reluctant to use opioids than happened after that. So, for about 30 years after that, the brakes got taken off because everybody started advocating for people in pain to get any relief they could. And the most commonly used reliever that was the most effective was opioids. Well, now we know that that was a big mistake. And that was a policy decision at the federal government level as well, pushing doctors to prescribe opioids, essentially. So I said, no, this is crazy medicine. I don't want to do opioids. I don't want to do procedures if I don't need to. So what do I do? So I decided to learn acupuncture. And that was in 1990. I finished acupuncture training. And in 1990, there was a whole lot of acupuncture around. And when I tell people I want to do acupuncture, they say, no way, stay away from me with those needles. Go away, go away. So I said, well, how do I do acupuncture? How do I take advantage of my training in acupuncture without using needles? But then I discovered they were using magnets on acupuncture points in the Orient. So then I learned about magnets, and I got magnets. I started using the magnets on a regular basis. So like fridge magnets, little tiny round magnets or bigger magnets. And then there were big flat magnets. They were flexible. There's a multi-level marketing company that was selling a lot of that equipment. So I started using them, and I discovered they were doing a lot of other things. I actually tested the magnets on acupuncture points and meridians and discovered they do make a difference. You can do nerve conduction testing, and you can see that the magnet affects the conduction of the nerves along the meridian. So clearly it works. Why? And then I started delving into why, because I was seeing other phenomena, like wounds would heal faster, pain locally would get better, tissues would heal better locally where you had the magnets. So I said, what's going on here? What's the phenomenon? What's the biological reason, the rationale behind this? And so the more I studied, the more I discovered that science it existed, but it was hidden behind the Iron Curtain. It was in the Cyrillic alphabet. It was in obscure journals in Eastern Europe. So along the way, when I was at a conference, I met a doctor, an MD, PhD from the Czech Republic, who got his PhD in magnetic field therapy in rehab. And he said, I have a manuscript. I've translated a lot of that literature for my PhD thesis, my PhD work. So he had a translation, and he basically offered me his manuscript. So we reworked the manuscript, and I published my first book called Magnetic Therapy in Eastern Europe, a review of 30 years of research. That kind of really blew the gates open. Now I understood why it worked, how it worked. They had done all kinds of studies on animals and test tubes and humans on the use of magnetic field therapy, both static magnetic fields, permanent magnets, and also pulsed magnetic fields. So that again just opened the doors wide open. Now I understood a lot more about why. And I said, well, why are we not using this more? It was known in Europe. At that point, when I wrote that book, it was 30 years of research. Now it's like 50 years of research. And so the reason is because the technology hadn't arrived here yet. And because it was obscure journals, there were no champions and there was no big money behind it. So I had to do my own learning. And then eventually we got pulse magnetic fields into the country, and we started working with those, and they started having all kinds of benefits. And the rest, as they say, is history. So when I started working with them extensively, then I published my second book, which is called Power Tools for Health, How Magnetic Fields Help You. And that book, I did that book from the perspective of people needed to know why it works. People needed to know that there's science behind this. It's not a sham. I didn't make it up. I'm not just a salesperson. I am a clinician, and that's where my heart is, to help people. But I need to know what I'm doing. I can't just be helping, just saying, here, take this. It's going to work for you. Don't worry about it. But you have to know how to use it properly for people to get the best results. And then you have to find the right equipment for the person, for their particular problems, and then teach them how to use it properly so they get the best results. And again, along the way, I discovered all the things that magnetic fields could do. And there are so many. The nice thing about magnetic fields is they pass through the body. So let's talk about magnetic fields. We're surrounded by them. The Earth is one giant magnet, right? We live in a magnetic field. And our biology is completely dependent on this magnetic field. The research is showing that when you go outside the magnetic field of the Earth, and the space station, they're still inside the magnetic field of the Earth. But if you go to the moon, you're outside that field. And if you stay in the moon long enough, you're going to have all kinds of breakdown of biological processes that are dependent on the magnetic field that we are live and breathe in. And all biology on the planet depends on that magnetic field. So a magnetic field passes through the body like it was air. It's like a body didn't exist. There's nothing in the way of the magnetic field when it comes to a human body. Metal will distract it or bend it or shape it or push it, but the body is completely transparent to it. And then as that magnetic field passes through the body, it stimulates all kinds of activity. And so in the first book, in Power Tools, I outlined 25 different actions of magnetic fields with the references to support those claims of actions. So I began to realize it's not about the disease. It's about the body and how the body works and how the body reacts when it has more energy. The human body is only about 25% efficient. The energy that we take into the body, primarily in terms of food, has to translate into work. Otherwise, what's the point of it, right? Other than just looking good or feeling good, maybe. But anyway, it has to do something. But we're only 25% efficient. Our bodies are only 25% efficient in translating energy into work. So that's why disease happens. That's why disease happens and lasts for long periods of time. That's why it takes a lot of work to recover from a surgical procedure. The body has to do a lot of work to recover, but it needs energy, and the body's not that efficient. So magnetic fields increase the energy, the efficiency of the body dramatically. No matter what tissue or organ you're talking about. But every tissue of the body is equally transparent to a magnetic field. Doesn't matter whether it's bone or brain or muscle or fat, skin, it doesn't really matter. White blood cells, red blood cells. So it's phenomenal technology, and it does, as you said, a lot of stuff. So the way when it goes into the body, it increases charge production. It increases the amount of production of energy in the body. And that energy, the charge that's produced in the body, then begins to be used by the body for whatever it needs. So at the very least, it's increasing the efficiency. So if you don't have a problem, you're just basically just increasing efficiency. And one of the ways it does that is through ATP, increases ATP production. And ATP is the energy molecule of the body. So if it does that, but if you have a problem, if you have a fracture, magnetic fields can heal the fracture in about half the time. If you have a skin wound, it'll heal the wound in about half the time. It doesn't matter whether you're a rat, a mouse, a dog, a cat, an elephant, or a horse. All biology is relatively equally affected by magnetic field therapy.
So I think this is so fascinating, but I know there must be some people out there saying, but wait a minute, I thought EMFs are harmful, like, oh my gosh, I'm living near a cell phone tower, or, I'm putting the cell phone near my head, listening, and that can give me brain cancer. Like, wait a minute, I thought that these were dangerous, these electromagnetic waves. So how would you know how to use them in a therapeutic modality in a way that it's going to be beneficial as opposed to harmful? And is there like a fine line between the two? And what's the difference between the pulsed versus the non-pulsed? So this sounds so complicated.
It's actually it's more complicated to try to understand it than it is to use it. Fortunately, to use it is relatively easy, but it depends on the problem and the person and so on. So to go back to your question, the elephant in the room is EMF. Right? As you said, everybody's scared of EMF, 5G, 10G, whatever the G's are, right? So what happens then is that the G's, the EMFs, I call them environmental magnetic fields. They are electromagnetic fields, but they're environmental. They're designed for other purposes. They're designed for communication primarily. They're not designed for health. So an EMF is a very high frequency, and it's a waveform that's broadcast into the environment. It's broadcast from a tower, from a transmitter out into the environment. And basically whatever, it just goes on and on and on and on. This is what we call open loop. And these very high frequencies are absorbed by the body. So when a body gets in the way of these EMFs, the body actually begins to heat up. And it penetrates the body minimally. So it's a very shallow level of penetration. This is the basis behind microwave ovens. So when you use a cell phone to your ear, almost always you'll notice when the person takes the cell phone away from the ear's red. And it's not because if you take a cell phone and put it up against your ear and it's not doing anything, the ear doesn't turn red. It turns up minimally, just slightly red, but not significantly. But the ear becomes significantly red because it's being cooked by the EMFs coming out of the cell phone. And if you have Wi-Fi in the house, those EMFs are being broadcast throughout the house, being broadcast out into space, essentially. Now, that's EMF. It's designed for other purposes. PEMF, which stands for Pulsed Electromagnetic Fields, are different. They are produced by a device that produces a current, and that current then is pushed through a wire. And then that wire then basically creates a coil or a loop. And then that loop, I can show you one, I hope. No, I don't have one here. But that loop, basically the current goes out, goes in through the loop, and then it comes back, the source. So that loop, once you widen that loop from a wire like this to a loop, then basically the current in that loop produces a magnetic field that then can go into the body. So it's a pulsed magnetic field. So my thumb is the wire, current flowing through the wire. And the magnetic field is being produced at the pulse rate of the device, goes like this. Right? It doesn't leave its source. It always comes back. So that's called a closed loop. That's not EMF. It's not high frequency. It's a pulse. And it goes into the body and comes back to the source. And it's very, very safe. So these PEMFs are designed for healing. EMFs are not designed for healing.
Are you tired of living with chronic pain? Medication only masks the symptoms, but real healing starts at the cellular level. I'm Dr. William Pawluk, the leading expert on PEMF therapy. Pulsed electromagnetic field therapy is a science-backed, drug-free solution that helps reduce pain, speed up recovery, and improve overall health, right from the comfort of your home. Take advantage of an exclusive 10% discount on drpawluk.com PEMF systems. Visit drpawluk.com, that's drpawluk.com, to register and claim your savings. This limited time offer is available only to registered listeners. Don't miss your chance to experience the benefits. Terms and conditions do apply. Don't just manage pain, transform your health. Visit drpawluk.com today and let's get started on your healing journey together.
Well, I think that's a really important distinguishing group of features there because it is confusing because they sound so alike. So, in terms of women with PCOS, they have such a wide array of symptoms and metabolic issues, reproductive issues. So, this sounds like it would offer maybe a great deal of potential for women with different issues with PCOS. What would you suggest would be the use of this amazing new tool? It's not really new. It's like new to us, but it's been around for, like you said, decades. But how could women with PCOS potentially benefit from using this new form of energy to apply it to their bodies?
All right. So women are organic. Men are organic. Males are organic. Women are organic. We could have a lot of discussion about gender identity versus gender. You can't fix gender. You can try to manipulate it, but it's still gender. It's still what it is, biologic, tissue-wise. So women have all the other problems of any biological organism. They are slanted towards the female because of the chromosomes. But basically, it's still tissue. It still has to heal. You cut it, it has to heal. You break a bone, it has to heal. And women may heal somewhat differently when they have injuries or challenges, but not a whole lot differently. Fundamentally, we essentially are equal as far as males and females. So women are still subject to heart attacks, subject to strokes, they're subject to arthritis, they're subject to, again, broken bones and wounds and so on, autoimmune diseases. So that aside, take that as a commonality that all biology has to deal with. So, and I usually tell people when they buy a magnetic therapy system, they don't own it. The house owns it, including the dog, the cat, and the plants. So all biology can benefit from it. So relative to PEOS, which is a feminine problem, although in a sense, actually males could have PCOS too, in a somewhat different way. Maybe not at the same extremes as women can have because of the hormone milieu that exists in a female body. So PCOS is caused by hyperinsulinemia, having insulin levels that are too high. And what causes that? Too many carbs, fundamentally. And that insulin resistance is part of that problem. So in other words, you raise your glucose levels, which causes the body to produce insulin, and then the body produces too much insulin, and eventually the body's crying wolf too much. And so you begin to develop insulin resistance. And that leads to type 2 diabetes. And so because of the flood of hormones that are being created by all these physiologic changes due to hyperinsulinemia in particular, then you get all kinds of hormone effects. And so at PCOS, clearly we know that women produce way too much androgen. And then that then causes that, and the cycling of the estrogen and the progesterone and the androgens in the body then ends up causing polycystic ovaries. So what do all those changes in the physical changes in the body cause? Then they cause all the symptoms of PCOS. So menstrual irregularities, painful ovaries, the problems of excess androgen, acne, oily skin, weight gain, with fertility problems because the ovaries again are not working properly because of both the hormonal milieu, but also because of the cystic ovaries, depending on how bad the polycystic ovary problem is, and how many cysts you have. So when you have too many cysts, it compresses the tissue, so the tissue can't work as efficiently, as effectively as it should to do what it's supposed to do, which is to produce eggs and hormones. So, but all of this then ends up creating mood issues. So pain, mood issues, menstrual irregularities, and then metabolic syndrome, again, prediabetes or diabetes. So magnetic field therapy then basically helps the tissues to normalize themselves. Right? You still have to do the metabolic work that you need to do. But the damage caused by these metabolic and hormonal irregularities then can be managed by the magnetic fields to make the tissues healthier, to make the tissues more balanced and more normal. So you might be able to, in fact, a woman who's developing polycystic ovaries at the early stages of it, if she starts doing magnetic field therapy to the ovaries, they probably won't become as cystic. It doesn't take care of the metabolic issues. It doesn't take care of the hormone issues, but it does help physically with the tissues. And magnetic field therapy, one of the key benefits of magnetic field therapy is it's great for depression, it's great for anxiety, and there are tools that we have available as well to help with sleep.
Well, I'm glad you brought that up. I was just going to go into that area. I know in psychiatry, they've been using electromagnetic radiation for a while, and it's FDA approved. I mean, it's not out in the fringes anymore at all. It's really mainstream. And women with PCOS have very significant rates of mood disorders, anxiety, depression, and as you mentioned, sleep. So I'm thinking that, I'd like your feedback on this. One of the things that women with PCOS have is problems with their circadian rhythm because in terms of hormonal imbalances, the master clock, the master clock that sits atop the optic nerve has receptors for these different hormones and, including estrogen and of course, cortisol and so on. And when these hormones are not being produced in the proper amounts and rhythms and so on, you end up sort of living a life of jet lag, which is really harmful for the whole metabolic system. So I was wondering if the PEMFs are helping perhaps at the brain level. In addition, it helps at all the other different tissue levels, but within the brain itself to maybe help normalize the circadian rhythm, which then can lead to a cascade of benefits in terms of mood and sleep and also appetite regulation, because there's this interplay between the nutrient sensors and the master clock and the hypothalamus, if that puts out the little signaling factors that go to the pituitary that puts out the gonadotropins, all of the system, which is in such disarray in women with PCOS. Maybe this could help normalize it. And there's a chance that it could help them not only feel better emotionally and sleep better, but maybe help get them more regular menstrual cycles. Any experience with that?
Yeah, so PCOS has been studied a little bit. Magnetic field therapy has been studied a little bit in PCOS, but not a whole lot. We get a lot of the information about what magnetic fields are doing from all the other research that's been done on what magnetic fields do in the body biologically. But yes, the clocks are very important. And we not only have the master clock, which is the circadian rhythm, but we also have tissue clocks, metabolic clocks of the tissue that don't really relate necessarily directly to the master clock. So PEMF therapy, one of the things I discovered very early on, as I mentioned in my initial comments, is that I started learning PEMF therapy because I was trying to do acupuncture. What I discovered then is that magnetic field therapy actually treats the acupuncture points and meridians. And there's plenty of research now to show that. And I taught a 6-hour workshop for acupuncturists on how to use PEMFs in acupuncture. So every time you do magnetic field therapy, as long as there's a meridian or an acupuncture point in the area of the magnetic field, the whole meridian system is being influenced. So that means you're doing acupuncture at the same time you're doing magnetic field therapy. But the difference between acupuncture and magnetic field therapy is acupuncture is indirect in the way it works, and acupuncture works on mood disorders. It works on the brain. It works on the hypothalamus. That's one of the reasons people feel good with acupuncture, and it increases endorphins and enkephalins, the feel-good hormones, right? So magnetic fields will do that too. But if you aim a magnetic field at a pituitary gland or a hypothalamus, right, or our limbic system, it begins to produce energy in that system that then begins to rebalance it. So this is, as you mentioned, this is where the FDA-approved devices for treatment-resistant depression, which are now covered by insurance companies to a great extent. So that improves not only the mood, but it has all these other downstream benefits as well. So PCOS is in a sense, is like an elephant. That's maybe a horrible analogy, but the idea is that you got blind men touching the elephant, and each person touching the elephant sees a different part of the elephant and said, this is what the elephant is. And that's what the elephant is. So you could focus on one aspect of PCOS, and you're still going to get benefits on other aspects. Sometimes when you do one aspect, everything else begins to fall in place as well. So often just by doing any kind of PEMF treatment, you're going to get a benefit overall. So we know it improves mood. Sorry?
Oh, no, go ahead.
So we know it improves mood. We know it affects the circadian rhythm system. And there are different kinds of magnetic field systems that we do and we use depending on what the problems are. So you mentioned the high-intensity PEMF devices that are FDA approved. Well, the PEMF devices that we use, that I recommend, can treat the brain too. So PEMFs in general are considered very safe. I can't claim that my device does what the FDA-approved devices do, but they're very close in what they do. And the good thing about it is you can do it at home. You don't have to go somewhere and pay somebody else to do it for you. And then you may have to wait 2 or 3 days before you can do another treatment. So what I advocate is daily home treatments, because then you can keep up with the effects, the benefits, so you don't backslide in your benefits. If you're getting treatment somewhere else, you have to pay for it if the insurance doesn't cover it. And other than treatment-resistant depression, insurance does not cover these high-intensity machines for the brain. So that means that you're on your own, paying on your own, and you could be paying $150 a treatment. So how long was that going to last? And now even in depression, we're discovering that we thought initially it was like 5 treatments or 10 treatments. Well, now it's up to 70 treatments in order to maintain the benefit. So if you're going to have to do 70 treatments, again, you might as well own your own system. But you're going to have to be willing to spend some money to do that, because to get that kind of benefit, you're going to need a higher intensity machine. And one of the key problems in PCOS is inflammation. That's all the metabolic syndrome stuff. Advanced glycation end products attached to tissues, attached to the brain, and they cause inflammation. So, and then weight gain is a major issue, and weight gain is associated with inflammation. So PCOS, magnetic field therapy doesn't stop the PCOS process. It helps the body to be able to adapt to it. And when the body feels better, the body gets better, the person thinks better, feels better, then the PCOS process begins to settle down. Now, again, hopefully you start that therapy early, because the more advanced the PCOS is, the more difficult and challenging it is to deal with it. And then you often have to resort to hormone therapies to get some degree of control. So for the circadian clock, we can use magnetic devices that are small, portable, battery operated. We have two that I recommend for this. One is called a Flex Pulse. And it has 10 programs in it, which controls brain waves. So you can wake the brain up, you can make the brain relaxed, or you can put the person to sleep. So you have 10 programs. You could also get into what we call gamma, which is a meditative state. So I routinely use a sleep program in bed, 3 hertz, delta. So that's the deepest sleep we have during the night. So if you present the brain with delta all night long, it causes you to sleep faster, fall asleep faster, stay asleep longer, stay asleep deeper, and then hopefully wake up more refreshed. So that's one of the programs in the Flex Pulse. So we designed another machine called the X-Pulsar. So it's xpulsar.com. And we have a separate website for Flex Pulse called flexpulse.com. And that explains all the different programs in the Flex Pulse. So the Flex Pulse has more flexibility because it has more options. The X-Pulsar only does the sleep option. So if you could sleep better, and it costs us $699. So how much is a night's sleep worth? It's not $25, I'm sorry. All right, so these devices can help with sleep. If you help with sleep, a lot of other things begin to get better. Mood certainly gets better. Energy levels get better. Your ability to function during the day gets better. Headaches would get better. And because these devices actually tune the brain, you may be able to begin to tune the cycling processes of the body. And the hormonal cycles in male or female bodies, for that matter. Now, the higher intensity machines will do better with that, but it's hard to find higher intensity machines that have the flexibility of those different frequencies. And that's due to the engineering and the sort of like the physics of it. So to treat mood, you could use the high intensity systems that may or may not help you with sleep directly. They may help you with sleep indirectly. However, I find, and I just had a consultation with somebody yesterday who's saying, I have a problem with sleeping when I use this high intensity machine. It's helping me with my pain. It's helping my body in general. I feel a whole lot more energetic. My life is better, but it's aroused me for sleep. And I said, well, then don't do it so close to bedtime. And even because it increases energy so much in the body that, again, that carries over into sleep. So then you may need to have a separate piece of equipment like the X-Pulsar just for the sleep part of it. The high intensity machines cost a lot more.
Your body was designed to heal, but illness, chronic disease, stress, injury, and time can slow that process down. What if you could restore your body's natural ability to recover, recharge, and feel its best? The key to healing is giving your body the energy to repair itself. PEMF therapy does exactly that. Recharging your cells, improving circulation, reducing inflammation, and helping you function at your best. For decades, I've studied this technology, worked with hundreds of medical professionals, and helped thousands of people reduce pain, regain energy, and take control of their health. However, not all PEMF devices are created equal. No one size fits all. We offer personalized consultations so you can find the right device for your needs, backed by real science and trusted results. If you're ready for a real solution, let's talk. Schedule a consultation at drpawluk.com. That's drpawluk.com, because real healing starts at the cellular level.
Well, it's a fascinating new way of thinking of applying a therapeutic approach to women with PCOS because, like you said, I do actually think that your elephant analogy resonates with people because a lot of women go to multiple doctors and each one just treats one little piece of the pie. One little part of her problem is addressed and usually just symptoms, not really getting to root causes or underlying issues on like what you're talking about, a cellular level, talking about like ATP, production of energy, which is a big problem. Like women with PCOS are very good at the skill set of making and storing fat, but not so good at the skill set of burning fat and creating energy. So, like, you live in a sea of energy, but you can't properly access it to create energy and then feel good, and energized. And then, of course, you need energy. That's the differential between life and death is producing energy, right? And that's why, you look at the brain, they do EEGs, right? Look at the heart, they do EKGs, right? Looking at electrical pulses. So, it's like getting to the root issues of how the body actually functions. And I always talk about all living creatures on Earth have evolved to live on Earth. So we are working in conjunction with the 24-hour rotation of Earth, the circadian rhythm. And we all live on Earth in the electromagnetic fields of Earth, right? And sometimes when things go awry, we need some help in all of these departments. So this is like amazing. So in terms of like using these devices, I mean, do you actually like put something next to your skin or they're actually visible magnets or like how do these devices get actually used by the individual? And does it cause any kind of pain or do you feel like little like electrical like oh it's like a spark or something like a little shock or like what does it feel like and how do you actually use the devices?
Before I go into that, and I think that's a critical question, and that ultimately is going to determine whether you get a benefit or not, right? So if you don't buy the right equipment, you're not going to get that benefit. So you have to get the right equipment in the first place and then use it properly. But as an intro, in a sense, to that, magnetic fields cause you to experience something generally right away. You have a physiologic reaction. As you continue to use the magnetic fields, they begin to make functional changes in the body. So as they start to stabilize the hormones, they start to stabilize mood, you start to improve your sleep, then you start to have functional changes in the body. In the long run, what we're the most interested in is healing. So PCOS, autoimmune diseases, and how many women have PCOS who don't have something else going on too? Like an autoimmune disease, like Hashimoto's or lupus or rheumatoid arthritis. The list goes on. So you're helping the whole body with all the different things that could be going on in that body. So healing in the long run is the most important thing. Because if you have pain and you take an aspirin, you can get temporary relief of your pain, right? But it's not going to heal anything, typically. So you want to be able to heal. You want to be able to get the other benefits, but in the long run, you want to heal. So the healing process takes more time. So people who have fractures that won't heal, so a fracture that hasn't healed for 6 months is called a non-union fracture. It could be a forearm. It could be a bone in the hand. And those fractures take 9 hours a day of treatment to heal in 3 months. 9 hours a day of treatment to heal in 3 months. That's how much work you have to do to get that healing going. With magnetic fields, speed it up. If you don't do the magnetic fields, you can go 6 or 7 years without healing that bone. So the magnetic fields can kickstart that healing process. Having said that, then again, what devices do you do? A lot of devices that are available in the market today, and we have to be careful. People are being sold through a multi-level marketing company. They're being sold devices that are extremely low intensity. So intensity of the magnetic field matters. For example, we know to decrease inflammation in the body, you need 15 Gauss. So Gauss, Gauss, is the measure of a magnetic field intensity. So you need 15 Gauss at the adenosine receptor. So adenosine is a molecule that helps the body fight with inflammation. We know it's part of the molecule that creates energy, ATP, so adenosine triphosphate. So you have to deliver 15 Gauss at the adenosine receptor, and then you have to calculate the dose that you need to start with to be able to deal with inflammation deeper into the body. So superficially in the skin, you only need 15 gauss. But across the brain or into the ovaries, which are deeper into the body, or into a uterus or into a liver or a pancreas, you're going to need a much stronger magnetic field. So for example, you need about 4,000 gauss to be able to treat across a brain to decrease inflammation throughout the brain. Right? So you need the right magnetic field intensity. Having the right magnetic field, then you have to figure out how to use it. Daily use is critical. So with fracture healing, what they found with the non-union fractures, if you didn't do the 9 hours a day, if you only did 3 hours a day, and to people, sitting out there, you may say, "What? 3 hours a day? I don't have that kind of time." Well, you don't have a non-union fracture. If you had a non-union fracture, you probably would, because it's messing up your life completely. So if you typically did half an hour to an hour twice a day, you're going to be able to solve a lot of problems in that body. There are people who are selling these multi-level machines don't tell you what the intensity is. It's less than 1 Gauss. And you can spend $6,000 for a machine that gives you 1 Gauss. What good is that going to do for inflammation? It's going to treat the acupuncture points because they're very superficial, but it's not going to do deep healing work. So again, be careful what you buy. Always ask what the magnetic field intensity is so that you can do that calculation. On my website, drpawluk.com, there's a blog about adenosine and inflammation. And that blog gives you tables that tells you what the magnetic field intensity needs to be to reach deeper into the body. So getting the right machine in the first place and then using it appropriately every day. And depending on the problem you have, if you have osteoporosis as well, or you have osteopenia, then you're going to have to not only treat your PCOS and your ovaries and your uterus and your liver and your pancreas, and your brain, you're also going to have to treat your bones. And that means you have to treat the whole skeleton, because osteopenia and osteoporosis involve every bone in the body. And the big bones, the hips and the spine, are the ones we test for with bone density testing. But it's the rest of the skeleton that breaks more often. Right? A small fall under your forearms, you can break a bone if you have osteopenia or osteoporosis. So regular use, daily use, the right machine, and then just keep using it, and the body begins to heal itself. Results happen usually within days. Most of the healing is going to take place over a longer period of time, months to years, depending on how far the body has gone and how bad things are in a body, how much inflammation is in the body. So this is something that's going to take patience. But I think that the key for us is not to just treat PCOS, not to just treat insulin resistance, not to just treat inflammation. It's for general health and to slow down aging. All these other factors speed up aging as well, typically.
Oh, absolutely. In fact, I view PCOS as a state of accelerated aging. Exactly. What some clever person termed metaflammaging, the inflammation and aging that relates to metabolic dysfunction as opposed to chronological aging. And yeah, it's a huge problem. So I know that there's unfortunately so little research compared to other medical conditions that involve PCOS. It's like it's the most common endocrine disorder of women in the reproductive years, and yet the amount of research that's dedicated to it is so low. And so I'm just thinking you and I should get together and maybe start doing some research projects, because like when you look at women with PCOS and you think, well, this modality generally helps the whole body. It helps every cell to work better, to reduce inflammation, to regenerate better, to do everything better. And, by reducing inflammation, you lower pain, you lower cognitive problems, mood problems, like obesity, cardiovascular risk, you can go on through every organ system. Is there any data at all on fertility? Because so many women struggle with fertility problems with PCOS.
Well, and also a lot of women with fertility problems have endometriosis.
And women with PCOS have higher rates of endometriosis.
As well, exactly. And that's part of the whole inflammatory cascade of things that happen with PCOS or gynecologic disorders in general. And so Now, magnetic field therapy can be dramatic for all this. But again, we still have to solve the problem of the causes of PCOS, typically, which is metabolic syndrome. That's the primary root sort of component of that. Now, yes, you could have genetic issues. You could have ovaries by themselves or just doing crazy things with cysts and so on. That may not have nothing to do with metabolic syndrome. Well, that's a whole different ballgame. That's a whole different issue in a sense. And then you could really target the ovaries directly to get the ovaries to decrease the inflammation, to stabilize the hormonal milieu, and then so that things don't sort of cascade out of control. So you could use it for that. But I think the key thing with PCOS is helping the body to generally be healthier, decreasing the inflammation. Now you can decrease insulin resistance with PCOS. You're making the cells, the receptors of the cells, be able to use sugar better. You can decrease the irritability and inflammation in a pancreas that overproduces insulin. That leads to a lot of the hyperinsulinemia issues with PCOS. But mood is one of the key factors, right? If you can change the mood, because often if you change the mood, the hormonal cycling in the body also significantly improves too, right?
Oh, absolutely, because all of these things are interconnected. In fact, a lot of the pregnancy-related complications are, of course, related to the underlying metabolic dysfunctions. The inflammation in the ovaries themselves of women
Yeah.
with PCOS are related to poor embryo quality, poor ovulation, and the eggs themselves age more rapidly, and they're not as functional. They don't make as good an embryo because of that, and then you don't get as good an implantation and so on. So you have higher miscarriage rates. So just working on fundamental health, like you're saying, will help all of these different factors to become much improved. So I take it there's no pain involved in the therapy whatsoever. It's simple. Would you maybe just a quick overview of how someone would use this? And then the next thing is, because we could talk all day about this. You do seminars on these, so we're just barely touching, the topic and, just scratching the surface. So then I want to get into how can people who I'm sure the majority of everyone out there hearing this says, I want to learn more. So before we get to that, just a quick little overview of how they would use the device.
All right. So um, just like athletic training, you don't get off the couch and run a marathon tomorrow, right? Magnetic fields are causing the body to work. We're trying to stabilize the body. We're trying to restore balance in the tissues and balance in the hormones and balance in the endocrine system and the nervous system and so on. Well, that takes work in order to move or shift a body into balance when it's way out of balance. And obviously, the farther out of balance it is, the more work it's going to take it to get back into balance. So it's like athletic training. You're doing this all the time, and you're gradually increasing the intensity and the treatment time. I call that going low and slow. The risk that you run into by going to a practitioner's office for treatment is that because you're paying for it, the urge is to treat rapidly and with high doses of magnetic field, and that could be a mistake. And if you have other conditions like multiple chemical sensitivity or mast cell activation syndrome or fibromyalgia, so if you have any other sort of conditions that complicate the PCOS, then that makes it even more important to go low and slow. So what you're doing then is you're discovering what your body can tolerate. Yeah, you don't run a marathon tomorrow. You train, and then you do 15 minutes of training. Then you do half an hour of training. Then you do an hour of training. So on. You gradually build up until finally you can accomplish what you're looking to accomplish. Now, some people can do that rapidly, and some people have to be really slow, depending on how the body reacts. So I have on my website and in the book I recommend for people to get is called Supercharge Your Health with PEMF therapy. So the Supercharger book is very practical. If you want to geek out on the science, you can get the Power Tools for Health, but the practical book is Supercharge Your Health. And then that has an appendix in it about the adenosine receptor. It has an appendix about going low and slow, and it has an appendix on something called the magnetic sandwich, which is layering magnetic fields. So low and slow is the key. Gradually build up. Ultimately, the goal is to get to the highest intensity for the longest time. If you can do the highest intensity for 30 minutes to an hour at a time, then your cells are basically happy and healthy. What you'll find, though, is if you back off, you'll find you'll lose ground. Because again, it's making the body more efficient than it already was. And even if you're already very healthy, if you're 45 or 50, then the body needs a lot more work to maintain itself at a really good level. But backing off, usually you'll discover that you lose ground because you haven't solved the problem completely. Until you're fully healed, you haven't solved the problem. So low and slow, get to your maximum intensity and then maintain. And that's where daily use becomes very important. So the intensity of the magnetic field I mentioned already is important. And that adenosine blog on drpawluk.com, and it's also in the book, teaches you then the intensity that you need or where you want to work in your body. Low intensity devices, whole body low intensity devices that have crystals in them or have sauna in them, they're nice. They sound gimmicky and nice, but they have very low intensities. So you might feel better because of the acupuncture effects, but it's not going to do you much good in terms of healing deeper into the body. So getting the right equipment. Now, the way to find out where you get the right equipment is the book, Supercharge Your Health, has tables. It has charts that show you for different problems. This is the magnetic equipment that you need. And then I have a review of about 80 different health conditions. And I have protocols for each of those conditions. Which magnetic system is probably the best for that and how best to use it. And then adding nutrition. You can't build a house without bricks and mortar. You can't support a body without nutrition. If you want to build tissue, you need collagen. You need fat for the nerve cells and the membranes of the cells. You need minerals for bone healing. So you need the nutrients in the body for the body to be able to repair. Now, if you provide the nutrients but you can't absorb them properly, then that's a problem, isn't it? So magnetic field therapy can help you to absorb as well and utilize the nutrients that you are taking in. And for those people who have to be on medication, magnetic field therapy makes the medications work better. And very often women who are on lots of mood elevating medication or sleep medications with magnetic field therapy, gradually, I don't recommend, quickly, being able to taper off or get off the medication. So we provide guidelines in the book. And for those people who feel they need it, we provide free consultations. I have a medical team on drpawluk.com who does consultations for people, and they're free. The reason we provide free consultation is because it's so important, I feel, to get the right magnetic equipment in people's hands. Because I've heard this many, many times. Magnetic therapy doesn't work for me, where they bought the wrong machine and they didn't use it right. So they buy machines online, and then the people who sell it to them don't do proper training, or they can't because they're salespeople, they're not clinical people. So then they say magnetic therapy doesn't work. I said, it works. You just got the wrong machine. You don't use it right.
That seems pretty basic, but I think that's really key. It's like anything. It's not just the theory, it's the actual, brick and mortar, like you said, building the proper machine, using it properly, using it at the proper intervals and so on to get the proper result. So, you don't want to just look for the biggest bargain or the most expensive, or, you got to go for quality and you got to go for backed by science, and so I'm so impressed with what this whole new to most of us, area of medical therapeutics is really offering to virtually everyone, and very much for women with PCOS who really suffer so greatly, and the same treatments that were offered like 30 years ago seem to still be the mainstay in most practices. And it really, obviously, if it worked, then we wouldn't have this problem, because unfortunately, although they do have some benefits for some symptoms, they obviously don't cure anything. Like you said, aspirin doesn't cure people. And getting back to what you started with, I actually know someone personally who died from NSAID. So we do know that some of the most common therapeutics that are used do have some potentially serious side effects. And it sounds like there really aren't. When used properly, you haven't really mentioned any serious side effects from this modality.
So we talked about infertility. So I mentioned peace, and let's talk about that. In endometriosis, magnetic fields in endometriosis have about 25% fertility rate, which is better than in vitro, and a lot less expensive and a lot less traumatic to go through. So the research on the brain studies that allow the brain treatments to be approved by the FDA found that even extremely high doses and very high amounts of treatment over short periods of time, produce almost no side effects.
Wow.
And magnetic fields are extraordinarily safe. The rule is magnetic field therapy doesn't cause problems; it reveals problems. And when you're doing a magnetic therapy session and you have a problem show up because of that it's revealing that there is a need that needs to be fixed. And we could take magnetic fields and put them on different parts of the body: elbows, shoulders, backs, hips, knees, etc., and high intensities. And then if you have a problem in that area that the magnetic field is now showing you, then that area needs treatment. It's just
Wow.
showing you that you have a problem. So
Wow.
extraordinarily safe, whether it's mice or babies or pregnant women or animals of any kind. Animals routinely gravitate to the person getting their magnetic field therapy. Routinely, they'll lay on top of you.
Wow. This is such critical information that everyone needs to understand. I got involved early on with the whole concept of, grounding and earthing, and this is really going to a way bigger level than that, just like walking barefoot. Not that we definitely encourage that, but that this is really the real, like, going to the next level of therapeutic approach. And like, I would love to talk with you more, and I definitely am going to be reading your books and so on. And I can't thank you enough for joining me for this particular interview. It's been so enlightening and opening doors for so many people to a whole new area that they can look into for therapeutic benefits. So thank you so much for joining me. And I know everyone is going to be looking at your website and reading your books and learning so much more about this, for us, new therapeutic modality. Thank you again for coming on with me for this really informative session.
It's my pleasure. I'm glad to help, and I'm sure that we can help a lot of women do a lot better. Now, they still should use the other therapies. I'm not saying that magnetic therapy is the sole therapy. You still need to do nutrition. You still probably need to get some help with mood issues, maybe at least temporarily. So yes, magnetic field therapy works along with virtually everything else you're going to do. So it's something you can rely on totally. I don't normally recommend it because you still have to do, as I said, nutrition. And you may have to do hormones too.
Right, absolutely. We always say, it's never one thing, right? It's the total package, and this now can be added to the package for approaching the true healing of PCOS. So thank you, and we look forward to continuing to learn more about this topic.
Thank you. Have a great day.
Thanks for joining me on the PEMF effect. I hope today's conversation gave you new tools, insights, and inspiration to take control of your health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from PEMF therapy and holistic healing. Your body has the power to repair, recover, and thrive. Sometimes it just needs the right charge. Until next time, stay curious, stay proactive, and keep powering up to better health.